You have this stuck in your throat and it just won't go away. If you feel that irritating tickle, that constant urge to cough or to swallow something that seems glued right in the middle of your throat, know that you are not alone. Millions of people live every day with the uncomfortable sensation of persistent phlegm, and the worst part is that most of them have no idea what is causing it or what to actually do to fix it for good. Today we are going to understand the most common causes and reveal the natural measures that science has already proven to be effective in eliminating this problem. This content is informational in nature and does not replace the guidance of a qualified doctor or healthcare professional. But before we talk about solutions, you need to understand something fundamental that most people completely ignore about mucus, because this information will change the way you see this symptom forever. What is this mucus and why does it exist? Our entire respiratory tract, from the nostrils all the way to the lungs, is lined with a thin and continuous layer of mucus. This mucus is not there by accident. It works as a sophisticated protective barrier, capable of trapping dust particles, bacteria, viruses, and other harmful agents before they can reach the lungs and cause serious damage. Under normal conditions, this layer is produced in a balanced quantity and eliminated in a way that is practically imperceptible, fluid and transparent enough to go completely unnoticed. The problem begins when this mucus increases in quantity, changes in texture, or becomes thicker and stickier, accumulating in the throat and bronchial tubes in an uncomfortable way. This change is always a sign that something is happening in your body. It could be something simple and temporary, like a sudden change in temperature, or it could be the indicator of a more serious condition that needs attention. That is why understanding the causes is the first step before moving toward any solution. And the first cause is so common that almost everyone has experienced it at some point in their life, but few people know exactly what happens inside the body when it occurs, and that information makes all the difference when it comes to acting correctly. Respiratory infections. When your body goes to war. When viruses or bacteria enter your airways, the immune system responds immediately and aggressively, sending white blood cells, antibodies, and inflammatory substances to the site of the invasion. All of this mobilization generates intense inflammation in the mucous membrane lining the nose, throat, and bronchial tubes, which then begin producing far more mucus than normal in order to trap and expel the germs from the body as quickly as possible. That is why during a cold or the flu, you feel nasal congestion, the urge to cough, and a large amount of phlegm. In this context, productive coughing, the kind that brings phlegm up and out, is your ally. It is literally helping the body clean itself. But pay close attention to signs that the infection may have progressed into something more serious. Persistent fever, difficulty breathing, very thick secretion, greenish discharge or blood in the phlegm are all warning signs indicating that the body is struggling to defend itself on its own. In these cases, seeking medical evaluation is essential to rule out a complicated respiratory infection that could seriously compromise your health. Something that many people do not know is that the color of mucus, although frequently used as a popular guide to identify the cause, is not as reliable an indicator as commonly believed. Clear and fluid mucus is usually associated with allergies or irritation, but it can also appear at the onset of viral infections. Yellow or green mucus, on the other hand, indicates the presence of immune cells in large quantities, which can happen in both bacterial and advanced viral infections. For this reason, color alone is not enough to determine whether or not you need antibiotics, and that decision should always be made by a doctor. What few people know is that there is a second extremely common cause of phlegm in the throat that has absolutely nothing to do with the respiratory system, and when doctors discover it, many patients are completely surprised. Gastroesophageal reflux. The culprit nobody expected. Gastroesophageal reflux is one of the most underestimated causes of persistent phlegm in the throat. When the valve that separates the stomach from the esophagus does not close properly, gastric acid travels upward and can reach the throat, causing intense irritation in the larynx and producing that typical sensation of throat clearing, dry cough, and discomfort. The body reacts to this acid aggression by producing more mucus to protect the throat tissues, which explains the persistent phlegm even in the complete absence of any infection. During sleep, the problem becomes even worse because the acidic gases from reflux can be aspirated into the lungs, causing bronchial irritation and hypersensitivity with symptoms very similar to those of asthma. This resemblance has already led many doctors to treat patients with inhalers for months without any improvement, simply because the real problem was reflux all along. If your cough and throat clearing get worse when you are lying down or shortly after meals, reflux may be the true cause of your discomfort. But reflux is not the only chronic condition that can be behind persistent phlegm. There is another cause associated with a habit many people still maintain, and it may point to something more serious that requires urgent attention. Chronic bronchitis and dry air. Two enemies of your breathing. Chronic bronchitis is a persistent inflammation of the bronchial tubes caused mainly by smoking or prolonged exposure to pollutants. The result is an exaggerated production of mucus, chronic cough, and a permanent sensation of phlegm in the airways. Many smokers normalize these symptoms without realizing that chronic bronchitis can evolve into chronic obstructive pulmonary disease, which permanently and irreversibly compromises respiratory capacity. The only truly effective treatment for chronic bronchitis, confirmed by all available scientific evidence, is quitting smoking. No medicine or technique will solve the problem while the lungs continue to be assaulted by cigarette smoke. But even non-smokers can suffer from excess mucus for a more silent reason. Dry air. When the air is very dry, the mucous membrane of the nose and throat becomes irritated and increases mucus production. That mucus, in turn, loses water quickly, becomes thicker and stickier, and accumulates because it cannot be naturally eliminated. There is yet another little discussed effect. The cilia, which are the tiny hair-like structures that line the airways and push mucus outward, lose efficiency when humidity drops too low, compromising the entire natural cleaning process of the airway. This problem is especially common in winter with heaters running and in offices with central air conditioning running for hours on end. But there is still another cause that begins far away from the throat and surprises everyone who discovers it. Postnasal drip. When your nose drains inward. The paranasal sinuses and nasal mucosa continuously produce mucus to filter and humidify the air we breathe. Under normal conditions, most of that mucus is eliminated through the nose and out. But when production increases due to allergies, rhinitis, sinusitis, or changes in temperature, part of the secretions begins to drip down the back of the throat in a process known as postnasal drip. This drainage creates a constant sensation of accumulated mucus in the throat and a persistent urge to swallow that seems to never go away. Many people associate this discomfort with a problem in the throat itself, when in reality, the origin is entirely in the nose and paranasal sinuses. Identifying and treating the nasal cause is the most effective path to resolving the symptom. If symptoms persist for more than a few weeks, it is important to seek medical evaluation to check for undiagnosed allergic reactions, chronic rhinitis or sinusitis, all of which are treatable conditions with the correct diagnosis. But there is still a sixth cause, rare but impossible to ignore. It is something nobody likes to hear and that many people try to dismiss, but it can be absolutely vital to know before it is too late. When phlegm could be a serious warning sign. In some cases, persistent phlegm in the throat can be the first sign of a tumor. Certain types of cancer, affecting the larynx, pharynx, floor of the mouth, or esophagus, can cause increased secretions, local irritation, and symptoms such as chronic cough, throat clearing, and changes in the voice. This happens because the tumor triggers a continuous inflammatory response in the surrounding tissues, leading to excessive mucus production. This cause is rare, especially in people without known risk factors, such as smoking and excessive alcohol consumption. But it cannot be ruled out when symptoms persist for weeks or months without a clear explanation. The signs that should lead you immediately to a doctor include phlegm, persisting for more than 3 weeks without improvement, changes in voice quality, difficulty swallowing, and any palpable lump in the neck. Now that you know all the main causes, the most anticipated moment has arrived. Let us talk about what science actually proves works to eliminate this excess mucus, And the first solution is something you already have at home right now. Water. The most powerful and cheapest mucolytic in the world. Water is the best natural remedy for dissolving and eliminating excess mucus. When the body is well hydrated, secretions remain more fluid and easier to transport and expel. When fluid intake is insufficient, the body conserves water across all bodily fluids, including mucus, which becomes increasingly thick and sticky, clinging to the walls of the throat and bronchial tubes. Adequate hydration is especially important during periods of infection, when the body uses more water to fuel immunological reactions, or in dry environments, where water loss through the respiratory tract increases significantly. The general recommendation is at least 2 liters of water per day, but during illness or intense heat, this amount may need to be higher. A simple strategy is to always keep a glass or bottle of water nearby and drink small amounts every hour without waiting to feel thirsty, because thirst is already a late sign of dehydration. In addition to plain water, warm broths and expectorant herbal teas also contribute to hydration and to softening mucus. It is important to remember that caffeinated drinks, such as coffee and black tea in excess, as well as alcohol, have a diuretic effect and can contribute to dehydration, worsening the thickness of mucus. Prioritizing caffeine-free liquids throughout the day is a smart choice for anyone dealing with excess phlegm. But if you think drinking water alone will solve everything, wait. There is a second measure that seems too simple to be true, but that hundreds of scientific studies have already proven to be extraordinarily effective. Salt water, the ancient remedy that science validated. Saltwater gargles and nasal rinses are probably the home remedy with the greatest scientific backing in existence. When you place salt water in your throat or nose, you create an environment with a high concentration of sodium. The body, which naturally tends toward balance, responds by drawing water from the cells to dilute that concentration, directly hydrating the mucosa and the mucus in that region. The result is mucus that is more fluid, less viscous, and much easier to eliminate. But saline solution does more than that. Salt has natural antimicrobial properties capable of inhibiting the growth of viruses and bacteria on site, reducing inflammation and the excessive mucus production caused by infection. To prepare the solution, simply mix half a glass of warm water with half a teaspoon of sea salt or regular salt. For gargles, hold the mixture in the throat for a few seconds before spitting it out, repeating several times a day. For the nose, use a small syringe or a nasal irrigation device, tilting the head and letting the water enter through one nostril and exit through the other. The World Health Organization and numerous medical bodies around the world recommend this method as a first-line treatment for persistent mucus, precisely because of its proven effectiveness and complete absence of side effects. And if saltwater gargles are already surprisingly effective, the next strategy involves heat and steam, and you are about to understand why the Finns were right all along. Steam and heat. What happens inside your lungs when you inhale steam? Hot showers or baths with plenty of steam are a simple and effective way to soften the thick mucus accumulated in the airways. The heat and humidity of the steam penetrate the airways, directly hydrate the mucus, and make its consistency more liquid, making expulsion easier. In addition, the heat has a relaxing effect on the respiratory muscles, improving airflow and making breathing easier. A practical alternative is to prepare a home steam inhalation. Place very hot water in a deep bowl, lean your face over it at a safe distance to avoid burns, and cover your head with a towel to concentrate the steam. Adding a few drops of eucalyptus, peppermint, or thyme. Essential oil enhances the benefits, as these plants have decongestant and balsamic properties that help clear the airways. It is no coincidence that Finland, one of the countries with the best respiratory health in the world, has one sauna for every 3 inhabitants. For Finns, the sauna has been considered a preventive health tool for centuries, and the moist heat of saunas has exactly the same effect as steam inhalations. Modern science has confirmed what they had already been practicing intuitively for generations. But there is a group of medicinal plants whose effects on mucus have been proven in the laboratory, and the discoveries about one of them in particular will genuinely surprise you. Thyme, oregano, and ginger. The plants. Science has approved. Thyme is one of the herbs with the greatest scientific evidence for treating respiratory problems. Its main active compound, thymol, has a potent action on excess mucus in the airways, and clinical studies have shown that thyme extract significantly improves the symptoms of bronchitis, including productive cough and sore throat. Oregano, in turn, contains compounds that stimulate the production of white blood cells, strengthening the immune system, and also has proven expectorant action, helping to loosen and expel mucus. The infusion for both herbs is prepared with 1 to 2 teaspoons of dried leaves in 8 ounces of boiling water, left to steep for 10 minutes before straining. Ginger, however, is where recent science has delivered the most exciting discoveries. We already knew that its bioactive compounds have antibacterial, antiviral, and anti-inflammatory action. But new evidence has proven that ginger extract is capable of directly inhibiting mucus synthesis at its source, reducing its production from the very beginning of the process. At the same time, ginger relaxes the smooth muscle of the airways, improving airflow and facilitating the expulsion of any accumulated secretion. For the tea, use about 3/4 of an inch of fresh, peeled and chopped root. Simmer in 8 ounces of water for 5 to 10 minutes over low heat after bringing it to a boil. Strain and drink hot. These 3 plants together form a powerful and accessible natural arsenal for anyone facing the problem of excess mucus. It is worth mentioning that the combination of adequate hydration with the regular consumption of these infusions has a synergistic effect, meaning the results when used together are greater than what each one would deliver on its own. Consistency in use is more important than intensity. Drinking 1 cup per day every day is far more effective than drinking several cups on a single day and abandoning the habit afterward. But there is still one little discussed strategy that can make an enormous difference in daily life and that most people simply overlook. Humidification, diet, and the mistake you are probably making. Keeping the relative humidity inside your home between 40 and 50% is essential for preserving the health of the respiratory mucous membranes. When humidity drops, mucus dries out, cilia lose efficiency, and the throat becomes easily irritated. Electric humidifiers are the most effective solution, but simple alternatives such as placing containers of water near heaters or hanging damp towels in the bedroom at night also work well. In the area of diet, certain foods have a recognized ability to increase mucus production, especially dairy products in sensitive individuals, ultra-processed foods and fried foods, which have inflammatory potential. On the other hand, citrus fruits, pure honey, garlic, onion and ginger help control inflammation of the mucous membranes and thin the secretions. Adopting a more natural diet during periods of symptoms makes a real and measurable difference. Growing plants such as ferns, bamboo palms and dracaena indoors also contributes to the humidity of the environment, as these plants release water vapor during photosynthesis and respiration, passively improving the air quality in the rooms where you spend the most time. But there is a mistake that most people make automatically when they feel phlegm, and it makes the problem worse instead of better. Forced throat clearing, that harsh sound we make trying to dislodge secretion with force, creates a violent impact on the vocal cords and the throat mucosa, causing micro-inflammations that stimulate even more mucus production, creating a vicious cycle. The recommended alternative is to replace throat clearing with a gentle and controlled cough, combined with a small sip of water. We have now arrived at the final part, and what comes next may be the decisive detail for anyone who has been struggling with this problem for a long time: when to see a doctor and the definitive plan to eliminate phlegm. The vast majority of cases of persistent phlegm originate from simple and treatable conditions, such as passing colds, postnasal drip, dry environment, or mild reflux. In these cases, the natural measures we have discussed are enough to resolve the problem in just a few days. But there are signs that must not be ignored. Phlegm persisting for more than 2 to 3 weeks without improvement, fever, blood in the secretion, changes in voice quality, difficulty swallowing, or a palpable lump in the neck all require medical evaluation without delay. Bringing together everything we have covered, the practical plan to eliminate excess mucus starts with adequate hydration, at least 2 liters of water per day, combined with thyme, oregano, or ginger infusions. The second step is to perform nasal rinses with saline solution at least 1 to 2 times per day, especially upon waking and before bed. The third step is to take care of your environment, maintaining good humidity and ventilation, and reducing exposure to irritants. The fourth step is to review your diet, reducing dairy and ultra-processed foods, and prioritizing anti-inflammatory foods. The fifth and final step is to break the habit of forced throat clearing and to prioritize nasal breathing over mouth breathing. Of everything we discussed, the measure with the greatest scientific backing and recommended by most medical bodies around the world as a first-line treatment is exactly the simplest, cheapest, and most accessible of all: nasal rinsing with saline solution. Hundreds of clinical studies conducted over recent decades have confirmed that isotonic saline solution significantly reduces the symptoms of rhinitis, sinusitis, postnasal drip and congestion in both children and adults, with effects that equal or even surpass those of medications such as decongestants and antihistamines, without any of the side effects those medications can cause. The technique is safe for long-term daily use, including for pregnant women, the elderly, and children. The key lies in consistency. Incorporating this habit into your daily routine as part of your morning hygiene ritual is what transforms this simple practice into a powerful tool for respiratory health. And when combined with good hydration, an anti-inflammatory diet, and control of environmental humidity, the results can surprise even those who have been living with this problem for years. It is worth emphasizing that caring for your respiratory health is not something you do only when symptoms appear. Maintaining good habits continuously, drinking water regularly, sleeping well, breathing through your nose, avoiding environments with very dry air, and including anti-inflammatory foods in your everyday diet are all actions that strengthen the mucous membranes and significantly reduce the chance of excess mucus returning to bother you. Prevention will always be more efficient, cheaper, and less uncomfortable than treatment. Take good care of your health, because it is the greatest asset you will ever have.